Well, the state's newly proposed budget shows potential cuts for women's health care to the tune of $3.8 million.
25 News reporter Leah McNeil tells us how this could affect Texans across the state.
Clinics like the one behind me who provide contraceptive services as well as primary and preventative care who depend on state-funded programming like Healthy Texas Women and the Family Planning Program will be directly affected by these cuts.
So seeing budget cuts at a time when we know that these services are most at need really created some concern amongst our provider network.
Staffing, supplies, outreach, and education all on the potential chopping block. CEO of Everybody Texas, Cami Jeffrey, says she's advocating for the states to dig deep and find the funding.
Letting folks in the community know that these services are available to them. And that's really important at a time where we're seeing rising unemployment rates in the state of Texas, where we did not expand Medicaid to adult populations.
While these services are at risk, other healthcare options like alternatives to abortion are seeing an increase in funding. This, according to the Texas Tribune. Jeffrey says these clinics provide much more than contraceptive services.
We are seeing cancer screenings. We see screenings for sexually transmitted infections. We also see screenings for hypertension and other chronic conditions that many Texans face.
I mean, obviously, when they made the budget, they didn't want to cut any of those things. That's why they put them in the budget. And they're obviously not looking to remove those items from the budget. They're looking to reduce them some to help mitigate some of the loss in revenue.
With a projected deficit of 5% or $4.6 billion, Dr. Robert Tennant, interim chair of the Department of Accounting, Finance, and Economics at Central Texas A&M, says cuts have to come from somewhere.
They're considering and proposing reducing the cuts to try and balance the budget. It's a very precarious line to draw. They have to struggle over what is the most essential of those benefits to still fully fund.
But Jeffrey feels healthcare funding is non-negotiable.
These are the programs that will be the safety net for many women across our state. And it's really important that providers are able to both outreach and educate about these programs and fully staff these programs to offer these critical services.
Christine Mann with the Texas Health and Human Services Commission said in part, quote, "We will continue to work with the governor, the legislature, and stakeholders to make sure the budget decisions put Texans first, those we serve, those who have served, and the taxpayers whose money we are entrusted with," end quote. I did reach out to Governor Abbott's office about the budget, but as of news time, I haven't heard anything back. Leah McNeil, Killeen, 25 News.